Hi, I'm Dr. Miles Ashland.
And I'm Dr. Sam Ashland.
Welcome to the next part of our eye video series. A lot of you may wonder what some of the different instruments we do in the pre-test actually do. And today we're going to demonstrate some of those and explain them. So the first instrument we're going to go over is called an autorefractor. And this basically gives us an idea of the patient's prescription for us to start on when we're checking for glasses. So basically we're going to line his eye up in here, and it gives us some readings. And using these readings, this will give us a starting point for checking the prescription. Alright, and now I'm going to have him move over to the next machine. The next machine is called the tonometer, which is one that most people don't enjoy doing, but it's where the air puff test. And again, I'm going to line his eye up, and he's going to feel a little puff of air. And his pressure was normal, 18. But with this test, we're checking for elevated eye pressure, which is a risk factor for glaucoma if it's greater than 21. And for those of you who do not like to get the air puff, or in certain situations where we have somebody in a wheelchair or something where we can't get them up to the machine, we have a device called the iCare tonometer, which also checks the pressure similarly. So what I'm going to do is line this right up to his forehead, and I'm going to press this little button, and we get 17, which is very similar to the pressure we read on the non-contact tonometer. But this device does not require any anesthetic, and you really don't feel the device other than maybe a slight sensation.
This is an example of a fundus camera. This particular camera is called an Optos, and it takes a picture of the back of the eye and actually gives an extended range of a field of view of about 200 degrees. And this picture would have him looking down a tube here. Actually, you'll see on the map a picture of his eye. And as you're looking at the picture of the eye, we can take the picture, the photo, and he backed up there, and actually the picture comes out on the screen right here. And this is actually a picture of the optic nerve. Okay, and we can transfer this to the camera itself. And this is actually the picture that we just took of his eye. This is actually a picture of the right eye. What we do here is we actually look at the health of the optic nerve, the health of the vascular structures, which this is the retinal blood vessels, the larger ones, that's the retinal vein, the smaller ones are the retinal arteries. And when you do look at the optic nerve, you basically look for the health of the nerve. And patients with glaucoma, you'll look at the size of like the pink part of the optic nerve and the white part. This is called the cup. And in glaucoma, what will happen here, you'll have an increase in size of the cup. We also look for any signs of macular degeneration, which you're looking in this area of the eye. This is the macula. And points you can see certain pigmentation types, or certain spots on the macula or something called drusen buildup, which are indicative of macular degeneration. You can also look for things out in the peripheral part of the retina. Out here, we can look for little lines. This is particularly what's called a line of white without pressure, but you can also look for any holes or any development of any problems out in the peripheral retina also.
Thanks for watching today. Next time we're going to cover another machine that we use for glaucoma and a lot of other diseases called the OCT. And we'll discuss how that works and why we use it. Tune in next time. Thanks.